Risk factors for shoulder and elbow injuries in high school baseball pitchers. The role, preseason strength and range of motion. Timothy Tyler, Michael Mullaney, Michael Mirabella, Stephen Nicholas, and McHugh. Published in the American Journal of Sports Medicine on June the 3rd, 2014. Volume 42, Issue 8. This is a critical review by Joel Gretsch, Australian Catholic University, Masters of High Performance Sport. Identified in the literature, adaptive pathology may represent a significant portion of the playing population in baseball. These pathological changes have been previously linked to heightened injury risk. However, no quantifiable variables have been directly used as a marker for injury prediction. Tyler et al. Conducted a prospective study to assess the role of preseason shoulder strength and range of motion and the subsequent incidence of shoulder and elbow injuries in a sample of high school baseball players. The research aimed to provide further evidence for preseason measures of strength and mobility in overhead adolescent athletes to reduce their risk of injury. The authors concluded internal rotation loss is an adaptive pathology associated to the gross movement of overhead throwing, and athletes with low levels of internal rotation loss had a great risk of injury. Furthermore, the authors found that athletes with supraspinatus weakness in the dominant arm have an increased likelihood of injury. The implications of the research for high school baseball pitchers suggested by the authors is to promote preseason strength training of the supraspinatus muscle to manage the risk of injury. Players play on average 5.6 plus or minus 3.3 games per season. This represented about 10 to 36% of games over a 25-game season. The average pitch count per player was 48.9 plus or minus 26.8, with a maximum of 110 pitches set per game. This is set by the Little League Association in America. During this study, a total of 28 upper extremity injuries were reported. Of these, 19 were of the shoulder complex, with 9 representing the elbow injuries, with an injury incidence of 0.58. The major findings for the study: when we look at the dominant versus non-dominant arm, the authors found that the dominant arm had the same range of motion, however had altered kinematics and kinetics by a greater degree of internal rotation loss and a greater degree of external rotation gain. There was also found to be a greater internal rotation strength when, in the dominant arm, however no other side-to-side differences were isolated. The major findings for the study: when athletes had a below normal internal rotation loss, so when their internal rotation was similar to the population, they had a relative risk of 4.85. When there was a dominant arm supraspinatus weakness, the athletes had a relative risk of 3.60 of gaining an injury. And when it was a dominant arm supraspinatus weakness, there was a relative risk of 4.6 for the injury to be major and greater than 3 games lost. Authors found no difference in injury risk between ages. However, the volume trended towards higher risk of injury, so greater than 75 pitches per game. However, this was not significant and there was no effect recorded. Significance to the field. The authors aim to identify injury risk in high school baseball athletes from baseline preseason strength and flexibility measures. The relevant field has shown mixed results for strength and flexibility measures as a marker of injury incidence. The authors have added to the current body of knowledge that losses in internal rotation is an adaptive pathology from exposure to throwing overhead athletes and may be a protective mechanism. The authors further support preseason weakness of dominant arm supraspinatus as a marker of injury risk in high school baseball athletes. What was not stated was the training data, as I'll highlight later in this review. This is a problem as the training volume may have an effect on shoulder injury. The strength of the study: the measures were absolute and relative to the non-dominant arm and relative to weight. Absolute strength was compounded by age, growth, and maturation during the study. Authors identified this and controlled by making these relative measures. Strength testing used break tests, where force is applied to a contracted muscle until failure. Now, a break test, there is an isometric force applied to a contracted muscle, which means there is an eccentric loading of the non-contractile elements. Now, this is similar to the same forces that are applied to the external rotators during a pitch. The authors also use passive range of motion, which has been linked to shoulder injury and valid for external rotation, as the non-contractile elements are under load. Despite being a strong study, there's definitely some weaknesses in the methodology. The study design may have been influenced by covariates with particular mechanisms such as height, weight, maturity, and pitch type, and confounding factors such as frequency of games played. Now, the authors did look at relative measures, so supraspinatus strength relative to weight, and they found no effect. However, there have been studies that have looked at these characteristics, and they've been correlated to hitting power in baseball players. And there may be some influence on velocity of pitching and increase the likely forces subject to the shoulder and elbow. There's also been a close correlation to valgus torque on the elbow and players' weight in the same population. Further to this, the authors failed to whether to note if there was actually previous injury or pain in the paper, and whether this was assessed prior to commencement of the study. Now, both pain and previous injury have been linked with shoulder injury or coordination problems leading to shoulder injury. Now, there was no performance testing identified, and although the population being adolescent, they will confound performance changes just by changes in growth and maturity. However, pitch velocity and rotation power have both been recorded in previous work with junior baseball players, and it may have just given another view on injury causation. Now, injuries were not recorded as traumatic or subacute, and these may have different onsets and change injury prevalence. Now, these were identified later by the orthopaedic surgeon in the study. There were 6 acute injuries. There were 6 slap lesions, so superior labral anterior to posterior tears, and there was 13 rotator cuff tendinopathies that were subacute. There's also a thought process that the internal rotators during a pitch are eccentrically loaded during the cocking motion of the pitch, and then short, fast, concentric motion during the acceleration or the velocity stage of the pitch. Now, a more valid test may be a concentric strength test to look at the differences between internal rotation strength and external rotation strength. The authors used a brake test for this, which I discussed earlier. Player preseason load was not taken into account, so the frequency of games, frequency of training. There has been studies that have looked at load, and there may have been further evidence to suggest that there could have been injury risk there, or injury attached to higher loads. Although this is a strength of the study, there is a weakness with it. The same cohort was followed prospectively over multiple seasons. It wasn't noted whether injured players were more susceptible to being re-injured, and there's also a chance that if there is a higher level of people being re-injured post-injury, if they're continued to be involved in the study, there may be some issues with the data outcome. Continuing on with the methodology weaknesses, no standardised data was collected on exercise prescription, or there was no monitoring of training load. There were 4 teams used in the training study, so it is quite hard to control this variable. However, one of the biggest causing factors for injury in adolescent players is fatigue. Therefore, it may have been necessary to monitor training load, or at least standardise the monitoring of training load across all 4 teams. They only measured game pitching, whereas previous work has shown that pitching at even lower levels during a rehabilitation program has been shown to have high angular torques around the shoulder. So there's potential there that even during training, there may be still higher levels of force being applied to the shoulder. and it may be that players might have pitched 300 times during a week. They may have only done 50 on a weekend. This possibly underestimates injury patterns or overestimates injury rates. They also, although despite reading the results, they've obviously got relative measures there. They didn't report player anthropometric data in the paper, and there has been some link, which I'll discuss later, to height, weight, and power. Some of the other strengths of the study, the diagnostic tests that were used, the measures were valid and reliable for testing shoulder strength and range of motion. The shoulder complex is made up of structural and contractile elements. The external rotator contractile components of the shoulder are eccentrically loaded during the velocity phase of the pitch. The internal rotator contractile components are stretched during the cocking phase of the pitch and explosively shortened during the velocity phase. Scapular retraction strength and posterior shoulder integrity are important in end range throwing activities. So the tests that the authors have used are all valid and make scientific sense with pitching motion. However, one thing that wasn't clarified in the paper is there was no neural elements measured, and whether pain was evident or significant prior to preseason. As pain is an ability, as I mentioned earlier, to change the movement pattern and then lead to it. Continuing on with the diagnostics, the test of range of motion for internal rotation and external rotation. We had a posterior shoulder tightness test. Total range of motion lost, or total range of motion was collected for external and internal range, that is completely. They were valid and reliable. Posterior tightness had been previously reported in the literature by the authors. The major findings for our range of motion, for the range of motion area, was the below normal internal rotation loss, leading to a risk ratio of 4.85. In our strength tests, it was a break test for all of these. Internal rotation strength was tested, external, the empty can test, which is a supraspinatus test, and then scapular retraction. These have all got high reliability with a digital level and handheld dynamometer, which was used by the authors. The findings, most of these were unrelated to injury. However, the empty can test, so supraspinatus, as mentioned before, was below normal with a risk ratio of 3.6. The statistics used by the authors were sound and valid. The authors performed a time person method, and incident rate was given as a per player season. What this allows the authors to do is have a smaller cohort without affecting the sample size. So multiple players may have been tested across multiple seasons. Injuries were compared to per total exposure, so that's our incidence, and they'll standardise against data from above normal, below strength and range of motion measures. Injury was identified as a player could not pitch in the game, and this was confirmed by the orthopaedic surgeon later on. The injury incidence reported for game situations only. As we mentioned before, I think this is probably a little bit of a weakness in the study, and possibility that the injury classification was either injured or not injured or played. So possibly further classification and quantifying the injury time from the game may have been a stronger study. And the implications and the application of high performance. Implications of this paper for junior baseball athletes is the role for preseason strength training supraspinatus. Although the incidence of injury was highlighted, the incidence describes the players that cope with the load and those that don't. Genetic factors, body characteristics, previous injury were not identified and may confound the data. When we look at the current limit of pitching in adolescent athletes, which is limited to 110 per game, we did see there was a trend towards higher volume pitches to get injured. However, it was not stated about frequency of playing, and this has been shown that in previous work, or more current up-to-date work, that frequency of playing may also lead to injury risk or have higher levels of injury risk. One of the implications of that is that the authors were able to identify that adaptive pathology in overhead throwing athletes appears to be a protective mechanism. So volume actually may be needed to prevent injury in adolescent athletes if periodically planned. Training implications, so we're looking at total range of motion is exactly the same in shoulders. However, the breakdown of this percentage of internal and external rotation is different between the dominant and the non-dominant side. So we just need to take into account as a strength and conditioning high performance, working in high performance, there's certain exercises that may be contraindicative. The recommendations, overall, the paper I think was very sound. There's some weaknesses there that I have touched on today. Further recommendations would be that maybe more work is needed to establish the incidence of injury in both training and game situations to give a greater effect or understand the risk that's attached to pitching. There may also be warranted evidence, or there might be further need for injury and performance measures. So rotation power or pitch velocity may need to be measured, especially in a developing population such as the population is, so adolescent, in the effects of growth and maturation. There may be some injury risk around their ability to produce power and their ability to pitch the ball at high velocities. That is my current recommendation.